Hello, my name is Dr. Karen Hurley, and it is my very great pleasure to be presenting once again at a FORCE conference. What I'm going to talk to you about today is caring for caregivers. This topic will contain a mix of my experience of doing psychotherapy with many people who are in the position of caring for someone who either is going through cancer treatment or some aspect of managing their cancer risk. I'm a clinical psychologist at the Cleveland Clinic. I've been working in the area of hereditary cancer risk for over 20 years. And it is truly my privilege to serve the cancer risk community in this way by bringing these experiences together with the hope that they will empower, educate, and provide a sense of hope and a way forward for people who are facing the challenges of caregiving. So I'd like to state briefly that I have no disclosures to make, and any photographs that you see do not depict actual patients. So let's start a little bit with what caregiving is not. There is this phenomenon that I like to call the caregiver pedestal, which is that basically we treat caregivers as if they are saints with saint-like qualities that are not fully human, with the expectation that you're always going to be positive, maintaining a positive attitude, not only for your own benefit, but for the benefit of others who are along for the ride of the stressful caregiving experience, that you're always going to be strong and always loving. And so not having any mix of feelings other than that selfless devotion to the person in need. So when Sue first proposed this talk, the first thing that popped into my mind was there is a lot of material out there about what self-care for caregivers looks like. It's a very commonplace to recommend to caretakers, oh, you have to take care of yourself, put your own mask on first before helping others, which is something I've actually said in other talks, in other contexts. But here you can see there's this kind of idealized quality of somehow finding some Zen sense of peace within this experience by relaxation, listening to music, drinking tea. If you see photos that accompany articles about caring for yourself when you're a caregiver, you might see a photo of someone looking dreamily out a window while they have a steaming cup of tea in their hands. So what I propose in this talk is that we get real about what self-care looks like when you're in the grueling routine of caring for someone else. So what does getting real mean? So I want to do three things in this talk. One is to name the challenges, to be able to say, what is it that caregivers are going through, with the recognition that there is quite a spectrum, not only within caring for people who actively have cancer, but also what does caregiving mean in the context of hereditary cancer risk. Then we're going to talk about resources, gathering resources. So that's not just about caring for yourself, but having other people care for you as well. And lastly, to be able to talk about self-focus when you are so intently focused on the well-being of someone else. So one thing that we want to do in terms of starting to name the challenges is to recognize that caregiver situations have differing lengths of duration. There are short haul caregiver situations. This might be someone who is going through one of the less invasive risk-reducing surgeries, such as having ovaries removed, or someone who's in a very early stage of cancer treatment, where maybe they're having an excision or a excision of a breast lump, or a partial mastectomy that's not very extensive, or something of that nature. So in a short haul situation, the tendency is to power through on your existing resources. There's a certain level of crisis mobilization. Viewing the situation as temporary means that you don't have to make a lot of adjustments to how you do things. You simply, focus and go into a very intense mode, and other people will pretty readily rally around in a crisis, maybe who are available to do things that support the caregiver, such as arranging childcare or helping with meals. Long haul caregiving is a different situation. This might be someone who's going through a more invasive risk-reducing surgery. So someone who has to have a colectomy where there's a much longer recovery period, or someone who is being treated for a later stage of cancer. So this is where, instead of being in a crisis mobilization, the crisis itself becomes normal. And then there's this sustained effect of having the focus be on the person who needs care, and the way that everything else organizes around those care needs becomes the norm. And what can happen in this situation, because it's as the crisis stage becomes normalized, that's when caregivers are more at risk of becoming isolated, because other support people are drawn away by other life crises. So now, of course, those categories are not neatly defined, because, as we know, cancer does not color inside the lines. So someone can start with a risk-reducing surgery, such as someone who undergoes what they think is going to be a risk-reducing, So somebody is going through what they think will be a risk-reducing oophorectomy, and then it's discovered that the person does actually have an ovarian cancer in progress, and all of a sudden they're going to be going for chemotherapy. Or someone who chooses to undergo a bilateral mastectomy. They have the first stage towards having implants, and then there's some kind of infection or necrosis, and they wind up having 2, 3, 4 surgeries, and the period of recovery extends much longer than was anticipated at the beginning. So let's talk a little bit about what happens. What are the actual challenges that someone can experience when they become a caregiver? There's a lot of rearranging that goes on in terms of work schedules, childcare schedules, school schedules. And so each time you start rearranging schedules, everything that you had done to make that schedule work has to be undone, rethought, and reorganized. So that takes a lot of extra cognitive effort, as well as coordinating, to make all of this happen. Depending on what's happening with the person who is receiving care, they may need to get to lots of appointments that also has to be arranged. The person who is receiving care may be restricted in their activities, where the caregiver has to step in and support and help that person do things that normally the person themselves would do. There's a lot of extra memory tasks, such as remembering medication schedules, remembering, I'm going to take that out, remembering medication schedules. The person who is receiving care might need special clothing or new devices that you not only have to figure out how to obtain, but then how to use. Another thing that can happen is if the person you're taking care of is semi-mobile, for example, may be able to travel in public, but if they have bladder or bowel issues, then there becomes the organizational task of trying to figure out where can the person go to the bathroom in an urgent situation. Another thing that happens is not only do schedules reorganize, but people's relationship to each other in terms of getting things done also reorganizes. So if say you've got you're a caregiver spouse, and your spouse is the one who usually did the cooking, but now that's on you because they're not available because they're not feeling well. These tasks may feel unfamiliar. So not only are these added responsibilities on top of what you may already be doing, is that they may not fit your image of yourself, right? And so, especially as we get older, we value our competencies. We value that sense of being able to do things well. So if you're having to do something new that you don't feel like you are capable of doing, that can be excuse me, that can affect your self-image and self-esteem. Another thing that can happen is, even if you're in a caregiver situation, due to the unpredictability of cancer and recovery, the person's, it may not be that the person receiving care is laid out flat in bed. They may be active sometimes. Their ability to participate in things may be variable. And so some of that reorganizing of roles kind of shifts back and forth. It doesn't settle necessarily into a new routine. Currently, I'm doing therapy with a young couple where the wife unfortunately has a metastatic stage 4 colon cancer, and they have a 10-month-old. And so this is a situation where the patient was obviously looking forward to caring for her infant. And so on days when she has chemotherapy and has to relinquish care to either her husband or parents or in-laws, they're not doing the care exactly the way she would want to be doing. So then her caregiver spouse is receiving that frustration. And then furthermore, the caregiver spouse is getting all of these accolades about what a great parent he's been as he's been stepping up, while the patient is feeling even more frustrated that she's not getting recognized in a way that she would have wanted to. She wanted to be recognized as the mother. So another way in which caregiving is challenging, and this can be for any kind of family relationship, but some of these apply in particular to life partners and spouses, is that there are changes in activities that you're able to do together, how you how you show your togetherness through activities. So there can be a sense of loss that may happen without necessarily even realizing it. So, for example, the person who's receiving care may no longer be able to participate in activities that you both enjoyed. If someone has eating issues, maybe they're on a feeding tube, or if they're on chemotherapy and they've lost a sense of taste, is that food loses that quality of being a shared pleasure or social event. There may be plans and goals that you as a caregiver shared with the person who's receiving care. And so the person who is receiving care may be feeling frustrated about what they're no longer able to do towards those goals. But as a caregiver, you're experiencing that interruption, not because of a health challenge to you, but because of having to put the goal aside for these new tasks of caregiving. A particularly challenging situation is when a particularly challenging situation is when a person's illness or risk reduction plan involves a change in childbearing and family planning. And so that's a particular shared goal where, again, each person is managing their own feelings about how do they feel about this interruption, right, or thwarting of the goal that they shared together. Another thing that can happen is, especially if someone is in intensive treatment and is getting a lot of invasive tests, lots of blood draws, having surgery or multiple surgeries, is that this can affect sexual intimacy in different ways. And so the person may react by not wanting to be touched. And so the caregiver who's going through additional stress is also experiencing the withdrawal of something that may have been a comfort to them. So in the context of, okay, let me try that again. A lot of what I have just spoken about applies to people who are in cancer treatment. But one of the extra challenges of dealing with familial risk is, regardless of whether it's short haul, long haul risk reduction or cancer treatment, is the fact that the caregiver themselves may either also be at risk for the same syndromic cancers that the caregiver is providing care for, right? Or they may be worried about risks to other members of the family, particularly children. And then, of course, we do want to acknowledge the longest haul people who are caregivers of people who are who have metastatic disease, where there is not an expectation that the person is going to feel better, especially if they're starting to move into the stage of progressive disease. So this puts the caregiver in the position of providing care and being very present for the person while experiencing grief, not only for the losses that have already happened, as we talked about before, but for the loss that is anticipated. The person who's being cared for may have some specific legacy tasks that they want assistance with, whether it's creating a will or wrapping up affairs or creating some kind of memento that they want to leave to specific people. For example, I have a patient right now who is preparing a scrapbook because she knows that she will not be able to see any future grandchildren. She won't live long enough for that. So the caregiver in this situation is put in a position of releasing the expectation of their caregiving moving towards bringing a person back towards health, but rather keeping them comfortable, being supportive with them. And that this can be a very singularly lonely journey. So in terms of mobilizing resources for how to get through these challenges that I've talked about, one of the most important is to recognize that caregivers do get isolated, especially the longer a haul it is. And so to be active early on about minimizing isolation. And that means being able to identify needs, to have at least one person that you can confide in who can listen without judging or giving unwanted advice. Now with caregivers, because the demands can can eat into daytime hours, you do need the ability to reach people who are available when the person you're caring for might be asleep or late at night. Another thing that's really important, and when people go to support groups or reach out in different ways, is to be able to not only share experience, but also to share problems. Other caregivers may have already faced some of the challenges, and particularly may have good advice about things like how to manage hassles, how to navigate role strain, ways in which they have been able to reorganize their relationships and mobilize people who can be supportive of them. A special case that we want to give some attention to is that, we think of caregivers as being adults, but I certainly talk to many people, who recall being caregivers as teenagers, or sometimes even as preteens or school-age children. They might be caring for the person who requires care directly, or they may be taking care of younger siblings while someone else is providing the main physical care. So with younger caregivers, it's very important to help them maintain the normal routines that are appropriate to their age and development. So making sure that they do get to school, that they do still get to engage in activities that help them develop their own interests and competencies, and to allow them to have socialization time with their peers. One way to assist with this is to help young people, especially the ones who want to help and want to be there, to match responsibility to their age. So helping them feel like they don't have to shoulder the entire burden themselves, to help them set limits on their capabilities, which they may not be able to realistically judge. Some children will step up in ways that seem amazing. Adults around them might say, wow, this child is so mature, it's doing such a good job, but that can become a trap, because the young caregiver in that situation may draw self-esteem from being praised as mature, and may not be expresses. They may not be expressive enough of their needs and the issues that they are going through as a young person. So so young caregivers in this situation can wind up later in life sort of backtracking through and trying to recover that sense of lost childhood or lost teen years. So another thing that's really important as a resource is to be sure. Another thing that's really important is to be sure to engage in respite. Again, this is some advice that is very common in terms of taking breaks, but it's not just a nice to have situation, but there are specific physiologic reasons for making sure that you get respite. We know from research that if you expose someone to stress, which is followed by respite, they actually have an increased tolerance for new challenges. So there's a hardiness that develops, but that respite is important. Stress where there is no respite actually decreases tolerance over time. So someone becomes less and less effective, less and less able to respond to the changing demands of caregiving. Now, despite, this is all easy to say, but people will often avoid respite or say, yes, you'll get the yes, but response due to things like guilt or worry or that idealized view of caregiving in their heads that is telling them what they should be doing. So what do we do about this? So, I talk to lots of people about guilt when I'm doing therapy, and I've come to a definition of guilt, which is that basically it represents a responsibility that feels bigger than you. And there's something about the combination of responsibility and feeling inadequate to meet it that creates that sense of guilt. So that can come about in a number of ways, but basically it does reflect feelings about lack of control, not having enough time, feeling beset by the time constraints and time demands of caregiving. And then there's I'll turn that off for the next talk. Feeling beset by the demands of caregiving and feeling a sense of a lack of control over the disease or recovery process. One way that I like to express this is that helplessness or powerlessness is a breeding ground for guilt. So in conclusion, what I wanted to say is that the core of being a caregiver is that you have this intense focus on the well-being of someone else, but to care for yourself means being able to put the focus on you at least sometimes. So it's really important to recognize that this is not an either or. So if you see the two figures on your left, these Gestalt figures, you may recognize them from intro to psychology classes, or you may recognize them from other talks I give, because the ability to look at things flexibly is fundamental to our sense of resilience. You can see for each of the figures, for each of the figures, you look at it one way. For example, the one in the middle, it looks like a vase, and then it looks like two faces. Or maybe you saw the two faces first, and then the vase. But in either case, once your eye gets the trick that there are two different images in that, there are two different ways to see that same image, you start to be able to flip back and forth between them more flexibly. And that's the core of using your natural resilience as a caregiver to flip back and forth flexibly between that focus on the person you're caring for and focusing on yourself. And the other thing is that it's not 0, 100. It also is not necessarily going to be 50-50 because of the demands of the person's condition. So I put the yin yang symbol up because it represents a more realistic proportion, which might be 10-90 or 20-80, where 10 or 20% of focus is going on you. And then the rest of the focus is going on the other person, but there's enough respite embedded in that 10 to 20% that helps you keep going. And then you can also see the way that if we think of one half of the symbol as the caregiver and the other half as the person who is receiving care, is that between the extremes of one person being more dependent and the other person being the person being depended upon, there is still a balance between them. There is still a relationship. There are still things that you can offer each other in this apparent situation of dependency. So with that, I would like to thank you very much for your kind attention and wish you well in your care of your loved one.